I'm sure that someone in your life is on Medicare, so you may know that deciding on a plan can be incredibly complicated, but it doesn't have to be. Joining us now to discuss the annual enrollment period and some common costly mistakes that people make is Medicare expert Ari Parker, author of the book, It's Not That Complicated. Good morning.
Good morning. Thanks for having me.
So normally when you're going in to pick these plans, you want to get the most bang for your buck. You're trying to save as much money as you can. What are some of the costliest mistakes that people make when they're selecting a Medicare plan?
There's two costly mistakes that people make every day. The first is that they don't take advantage of the open enrollment period, which ends December 7th. Medicare plans change each year. People oftentimes don't appreciate this. And your health changes too. So it's important to review your coverage every single year. And the time to do it is now in anticipation of the December 7th deadline.
No.
The second mistake we see people...
Go ahead.
Pardon? The second mistake we see people make is that they don't appreciate that Medicare only covers 80% of your medical expenses. In order to have comprehensive coverage, you need to review the other 20% of costs that you otherwise owe out of pocket. And the good news here is that there's only two types of coverage to choose. One is Medicare Supplement, the other is Medicare Advantage.
Yeah, you were saying that, people don't appreciate that the plans change every year. I know for a fact they don't, because then people have to go back and do their homework on all of these plans all over again every single year. So what are the benefits to them actually changing?
Well, there could be massive benefits to changing. The first is that your needs change every single year. The doctors that you see, the medications that you take, and your priorities change too. The second thing is that the plans themselves change each year. And people already have a taste of this because last month they should have received an annual notice of change in the mail, which describes how your coverage will be different for the upcoming year. Now, if you're happy with the plan and you're happy with the changes that are upcoming, it's still important to take 15 minutes to review whether your doctors are in network, whether your prescriptions are covered affordably, and whether your priorities and needs have changed for the upcoming year.
So what are your tips to get people to maximize their benefits and save money?
Great question. I would recommend looking at your 3 Ps, which I write about in my short book on Medicare. It's Not That Complicated. It's an Amazon bestseller. Your 3 Ps are your providers. Who are the doctors you see? What are the institutions you like to go to? For example, MD Anderson. The second P is your prescriptions. What drugs do you take? Brand name, generic. What pharmacy do you like to go to? And the final P is your priorities. Maybe you have grandchildren that live in Arizona. Perhaps you have a second house in Florida. All of this will function into finding the right plan for you.
And how do you anticipate that changes in prescription drug costs are going to hopefully help people in 2024?
There's a big change to Medicare Part D. D is in drugs. It's a once-in-a-generation change. For the very first time, there's going to be a maximum out-of-pocket cap on drug coverage. So last year, many seniors paid close to $10,000 for their prescriptions, over 1 million seniors, in fact. For the upcoming year, there's going to be a maximum out-of-pocket of roughly $3,300. But that's only if you review your coverage to take advantage of the legislative change that's going into effect. And the time to do it is before the December 7th deadline.
All right, so another benefit to looking at those plans, looking at whether or not you want to change this year. Ari Parker,
Exactly.
Thanks so much for joining us. Go ahead.
And for more information, you can go to Medicare.gov, or you can visit our website at askchapter.org to get a free review of your coverage in anticipation of the December 7th deadline.
All right, Ari Parker, thanks for joining us this morning. It was nice having you on.